It's 12:01, so welcome everybody to our Amherst Community Chat on Thursday, November 12th. Today's special guest is our brand new Public Health Director, Emma Dragon, and she's joining myself, Brianna, Communications Manager for the town, and your town manager, Paul Bockelman. So we've got a lot of questions that were submitted for Emma today, and hopefully those in the room can feel free to also ask their questions live. Before we do that, I'm going to give Town Manager Paul Bockelman a chance to give any updates, and then we'll let Emma introduce herself. So
Right.
take it.
So really happy that Emma did a little glitch. She had to run to a new location across the street to be able to log on here. 1 minute before airtime, she's logged in. So nice and calm. Couple things I want to mention. One is that on Monday at the town council meeting, the University of Massachusetts made a pretty extensive presentation to the town council. If you haven't seen it, it's worth watching. They talked a lot about what is happening this semester, what their plans are for next semester, and those things all have direct impacts on our community. The other thing I want to mention was that yesterday was Veterans Day, and it was even though COVID, the VFW and the Legion and our Veteran Services Director, Steve Connor, brought a few people together, a very limited number of people, but was recorded on Amherst Media to recognize our veterans. And another new initiative led by Mary Beth Ogolovitz, our Director of Senior Services, was to gather a fair number of town employees together who we all then went out and took a number of veterans and gave little gift bags to them. And so there's a lot of preparation done in advance to put the gift bags together and then to go out on a beautiful, relatively warm day. And people were really appreciative of it, surprised to find someone at their door, first off, although we all had the proper PPE on, PPE. So it was a good day for everybody. So I want to mention those two things. I know we have lots of questions today too, so we want to get to Emma.
Okay, thank you, Paul. So yes, there's questions coming in and questions that were pre-submitted. So before we get to those, I figured we could give Emma a chance to introduce herself, tell us a little bit about her public health background and her experience. So Emma, feel free to go ahead and start that.
Hello, I'm Emma Dragon. I'm a nurse and I live in Hadley with my family. I have 3 young children and a spouse, Kyle, who is wonderful. Couldn't do anything, or none of this would really be able to be possible without the team behind me at home, as well as the team here at Amherst to be able to make public health in our regional area successful. I'm a nurse by background. I also have my EMT. I have my bachelor's in nursing and a graduate degree in emergency and disaster management, and have been working at Cooley since 2011 when I moved back into the area. I grew up in Hadley, so I'm very proud of the Pioneer Valley. I have nursing experience in emergency behavioral health and case management, as well as school nursing. I've been on the local Board of Health for Hadley since 2018, and I'm still currently on that board as of this time, as well as I've had the opportunity of being appointed on a state level regional and advisory council for local and regional boards of health to really promote public health and develop it further. And since 2009, I've had a federal position through Health and Human Services responding to numerous disasters and congressional events through the disaster medical assistance teams. And I just really want to thank the team at Amherst for being confident in my experience, welcoming me in the past 7 days, day 8 here. And I'm just really excited about all the hard but good work we're going to do together.
Great, and thank you and welcome, Emma. We're excited to have you too on our team. And there's been some chatter on social media that people love your last name, and they haven't even seen you in the dragon costume yet. So that'll be a little teaser. So stay tuned. We've got a couple of questions in the room live, and just now I think we'll try to take these ones first because they're less specific to COVID and public health related questions. So maybe we can take these ones first and then launch into the remaining ones. So this question comes in from Julie. It's not specifically for Emma, but she's wondering if there is an update on the North Village apartments demolition.
So I know, I don't have a lot of information on it. I do know that the last tenants moved out of North Village a couple weeks ago. And so they have the area blocked off to vehicular traffic. My last conversation with the university, which was some time ago now, is that they intend to keep moving forward with that project and get the renovation done as quickly as possible.
Okay, great, thank you. And while we're answering questions from the Q&A function, I'll just remind those who haven't joined us before, if you would like to ask your question live, please raise your hand in Zoom or *9 from a telephone, or feel free to use the Q&A function within Zoom. Another question here, without getting into political commentary, or any thoughts on what impact Joe's Biden election will have on Amherst?
Wow. I think that it mostly will on two levels. One will be the regulatory level. There were a lot of regulations, especially environmental regulations, were sort of put in abeyance, and things that the town has to comply with, things like that. I think that in terms of finances, in terms of COVID money, CARES, what was called the CARES Act funds, if that gets reopened for after December 31, that will be very important to us. We have had a substantial amount of CARES money so far, but that program ends on December 30th. And that's what's helped us maintain where we are so far. And also, I anticipate that all the sort of language about sanctuary community and things like that will not be as relevant. And those are all things that we've had to respond to, both operationally, but as also policy-wise as a community. So I think all those things will go by the wayside, honestly.
Okay, great. Thank you, Paul. So we did have a fair bit of questions that were pre-submitted, so I'm going to start looking at some of those. But for those in the room, feel free to, again, chime in with your live questions, raise your hand, *9, or use Q&A. So first question here, I imagine is for Emma. Can you clarify whether children can get tested at the Stop the Spread locations?
So I think this is a great question and kind of a moving target. Testing sites, availability, and the populations that they're able to test is kind of a moving target and constantly changing. What I really want to refer people back to is the Massachusetts COVID-19 testing site, where they'll tell you all of the current testing availability, where they are, if you can drop in, or if you have to make an appointment. And I really want to refer people back to that. The last I knew, the Stop the Spread sites are testing children, but that being said, things always change, and I don't want to give any misinformation.
And I'm not sure, Emma, if you have an issue with your mic or your volume at all. It's kind of coming a little bit in and out. So just a heads up there. Okay, so I'm going to move on to the next question. This we've had many times in different ways, so I'm just going to give a little context to the person who sent this in. They saw once in October that the COVID dashboard showed cases among college students separated out from town residents. For the purpose of understanding what is happening in town, can we have the data separated? For example, we've had 77 cases in the last 2 weeks, and it looks like most of those cases are UMass students. So basically, the gist of what this community member is asking is, are we going to, or are we able to separate out our case count that we report and update daily from our dashboard? And then the follow-up would be, if there is discomfort with putting it on the dashboard daily, can we have the data shared as a standard part of the town council meeting so that people can track what is happening in town? I'm happy to repeat any of that.
I think it's a I hope my mic is better now. I'm leaning forward, so hopefully I look okay. So, and people don't have to look up my nose. I think it's a great question. I think it's a comprehensive question. I think all of us want the most information that we can get. With that being said, this category, this asterisk that was put on that dashboard by DPH several weeks ago has since been removed. And the rationale behind that is that there isn't this bubble where the students are really contained. They are part of our community, the students and faculty. that they are with us here and we're all in it together. So the state's thought behind it was to remove that identifier. However, hearing your question, this is certainly something that we can try to look into. I don't know if I can speak to town council and what would be available there, but certainly I know on the department level here, we can take your question and look into it and see if there's anything we can do. But at this point, regardless of if those numbers were separated or not, we should all be performing the same public health measures that we've been promoting since all of this began, that we all need to remain socially distant, wear a mask anytime that you're in public, and limit gatherings, and that frequent hand washing that we need to all be doing.
Great, thank you, Emma.
Let me just jump on that a little bit. So there is a lot of interest in saying how many of the cases in Amherst are part of the university, and that's a legitimate question. But I think one of the challenges for that is that if most of the students who are still in the area are living off campus, so it's still that just because they're affiliated with the university doesn't necessarily mean that it means the rest of the community is, not exposed. Everybody's swimming in the same ocean here, and so separating that out wasn't necessarily I didn't understand that the public health value of that, other than targeting students, and that's not really where we want to go on this stuff.
And I will say we get a lot of questions on the COVID concerns line that equate UMass cases from their dashboard, meaning that they necessarily live in Amherst, and that's not always the case too. So that's another question we get asked a lot, is they see X amount on the UMass dashboard, for example, and wonder if, assume that it's all in Amherst, but that's not entirely the case every time. All right, we've got another question in the room. How do we get our public school kids back to in-person learning, and when do you anticipate this happening? What role do you foresee yourself taking in this ongoing discussion? And that question's for Emma.
So I certainly think this is a very complex question, and one that's being evaluated not just in Amherst, but throughout the state and throughout the United States as well. And I know that I've been invited to this school committee meeting this Friday, so I'm very eager for that. And I anticipate being able to give more information at that time, and want to encourage people to look at that meeting as well. I know that I'm excited and encouraged for everyone to look at the science and to promote everyone doing the best, safer option that we have. With that being said, there's just such an enormous benefit, mental health benefit, social benefit, developmental benefit, with our children being able to be in schools and the social interaction that us as humans crave and really need to be able to be sound, balanced, and have well-being. So I think it'll be a good start, and certainly a flurry of information, I'm sure, at that meeting. And I'm just really happy to be here.
All right, I got a follow-up question that came into the Q&A. And
Yeah, can't hear you. I'm free.
Can you hear me?
Yeah.
Okay. I was getting a call from somebody, so I had to mute that. So this comes in from Laura. It's a follow-up question to what we were discussing previously. Wasn't it true that the last time we had elevated UMass cases, we did not see a spread from students to other community members? How can we take this real-life data into consideration?
Yeah, I think that's a good question, and certainly something that we have not seemed to observe widespread community transmission throughout the age span of our population in Amherst. The majority of cases have been primarily of college age humans. And I think that's also part of being a young adult. is having their own challenges with being invincible in a way, and listening to recommendations for safety. I don't think they're alone in that. I think everyone's having trouble with that right now, but I just want to encourage everyone to do the best that they can to stay alert and to stay safe.
I think that raises a question. It's a real good question. I think a lot of members of the community are asking that type of question. And again, Emma's only been here 7 days, but I think once that giving more detail to people on the website might be a benefit. We've had other requests for more detailed information, like a daily count and things like that. And once Emma gets a little bit understands what's going on in town a little bit more, I think that's something that we could really develop. I think it'll be interesting to see what happens after school closes, come Thanksgiving, and what happens in the community at that point. So I think what folks are saying is we'd like more detailed information because it helps us understand the sort of gravity of the situation in Amherst. We anticipate our numbers are going to be going up. You can see the case numbers going up on a daily basis. But what does that really mean to me if I'm just a parent at home or with my kids or whatever? So we'll be looking at that some more, I think.
And that question kind of relates to another one that was pre-submitted. So I'll read this. Can you explain the difference between cases, outbreaks, and uncontrollable outbreaks? Am I correct in understanding that an outbreak is when more than 5 cases are transmitted as a result of one event or spread from one person, and an uncontrolled outbreak is when cases are spreading without proper contact tracing? And just for context, they give an example here that the UMass cases in September, that was an outbreak because the cases were transmitted from person to person, but it was not uncontrolled because we had proper contact tracing. Is that correct?
So I think that this is a reasonable question and things that people are thinking about, but I want us to really think about the language that we're using and the terms that I'm hearing in this statement aren't necessarily what we would be excuse me, my tongue got tied, using in the public health field for identifying these cases. I think the terms might be cluster or community spread. So I'd really need to maybe circle back with that person to really hear more in terms of what they're specifically looking for with the terms that I'm associated with to be able to answer better.
And I can connect you with that person who submitted that so that you can have that follow-up conversation.
Great, thanks.
Okay, so next question here. I'm worried about those experiencing homelessness in Amherst. What is the town doing to help them?
Well, that has certainly been something that I know that I've been working on daily, numerous times a day, working on that issue. Craig's Store is here in Amherst and already operating. I know that I have been regularly communicating with their administration to make sure that it's going to be a successful, safe shelter season as much as we can connect Craig's Store with state and regional assets that would be able to support them. And I know it's definitely a priority for us here.
Yeah. So yeah, I can jump in on that too. I mean, a ton of work has been gone into place, especially with Mary Beth Ogolovitz and Dave Zomack, who worked with Craig Stores, but just 100% of the credit goes to Craig Stores for pulling together a new shelter site at the Unitarian Universalist Church on North Pleasant Street, plus renting a number of rooms at the University Motor Lodge. And it's been just incredibly successful. I mean, there's still work to be done. There's a lot of, Emma, I know, is tracking down management plans and things like that that are required. And it was their first day was there on the day when Jen Brown was giving out flu shots at the community breakfast. So a lot of participation by the town, but again, getting these 2 new locations, I think it was really important. If you read the Gazette today, you'll recognize that Northampton is struggling with getting a location. It's another important location for folks. And so we're working with the mayor of Northampton or I'm working with the mayor of Northampton and other mayors and administrators in Western Massachusetts to get a dedicated site for anybody who's homeless or vulnerable like that for isolation and quarantine. Right now, the closest location is in Everett. And yes, they provide a transportation, but it's 100 miles away. And a lot of people don't want to get tested because they don't want to be told they have to go to Everett. It makes logical sense. So again, we're advocating with the Secretary of Health and Human Services to get a location in Western Mass. In Amherst in particular, though, tremendous response from the faith community and from the nonprofit sector. Craig's Doors that just did really, to get these two shelters up and running by November 1 was just heroic.
Great, thank you both. So another question just came in from the room. Do you think it is appropriate to wait for a vaccine before opening schools?
I think that there has been numerous mitigation strategies and researchers and experts that have looked into this in terms of school safety. And I really lean to them to be the experts in this case. There are many measures that are in place to make it safer in school. And with that being said, the guidance is that children with in-face learning is the best if we're able to do it safely with the appropriate measures. Paul, do you have anything to add on to that?
No, I think, I think what you said is, we try to follow the science, align ourselves with the state. We know that there's a mental health benefit both for both teachers and for students to be in schools. But there is very complicated is because you have to also take into consideration the collective bargaining situation that the schools are in. It's not just a unilateral decision by one person saying, yes, we're doing this, or no, we're not. It's a group decision that involves a lot of people. I totally get the frustration that many parents feel and how challenging it is. And also as you look at my biggest concern right now is you look at the prospect of a winter where it looks like the numbers nationwide are going up, that we're going to be really stuck in our homes, and that's going to be really hard for people.
Another question that we got sent in kind of jumps off of that last statement you made, Paul. This person's acknowledging that the cases are rising throughout the country. Is that happening here in Amherst? Are we on trend with the rest of the country in terms of rising case counts?
So I think that's a really good question. Massachusetts as a whole, it has a much lower percent positivity than other areas of the country, including the Midwest, Arizona, and I mean, I'm sure many here have heard about the unfortunate outbreaks that is happening right now in El Paso, Texas, and the many resources that they're requiring. Massachusetts has implemented countless mitigation strategies, including the mandates with mask wearing, the curfew advisory, and the gathering limits to decrease transmission, to really encourage us to follow the things that we need to do to decrease our exposure to the virus. So Massachusetts as a whole is definitely much lower. And even then, so Hampshire County is lower. And Amherst, as of this morning, with our data, our weekly data that came in from DPH, has only about 0.3% positivity, which is incredibly low. And I just want to have people continue to do the good work that they're doing. I know this is tireless work, and we're all in it together, and we're going to come on the other side of it as best we can.
Thank you, Emma. I'm just going to take a quick chance to remind those who are attending live with us that we've got 5 minutes left before we start wrapping up. So if you have questions that you want to pop in the Q&A or raise your hand in Zoom, feel free to do that. Otherwise, I'll go to the next question that we had here. How have the first few days on the job been? What's taken most of your attention?
Oh my goodness, it has been a flurry of excitement. It's been energizing and it has been almost around the clock. Even yesterday, which was a holiday for the town and many people still had work to do. Public health never stops. So a big part of what we've been doing is working with Craig's Place. Also getting to meet everybody on the team here and really see how welcoming and prepared everybody was and um, eager to have me here. Another thing that I know, Brianna, you're here on this meeting, that we're really excited about revisiting public health messaging with our community and seeing how we can improve that and meet our population where we're at. I think there's going to be good things to come, but it's just kind of getting onboarding, remembering your logins, right? And seeing what good things have already happened and see where we can improve on stuff.
I also want to just jump in to recognize Jen Brown, who had been the acting health director. Emma and Jen are making a tremendous team. Really appreciate the work that Jen has done during the interim period here.
Absolutely, Paul. Thank you so much for mentioning Jen. She is so extraordinary in terms of her ability to be flexible and available. I can't even fathom the work that she was doing during the interim time, managing all of her public health nurse duties in addition to the interim director duties. She's just really solid, and I know I'm really excited to be working alongside her in the public health department. And yeah.
Yeah, and so we've had some cases. We have a growing number of cases. So her work is our primary contact tracer. Mm-hmm. She's really good at, but she's also reached out to school nurses when necessary, mm-hmm. and to the state for support. And of course, UMass covers a big load of the cases. So contact tracing is really crucial because it has to be done really quickly. Once there's an identified case, you try to do that as soon as possible. So she's on the phone constantly trying to contact people and educate people. So you came in at just the right time because she had to step aside, put a lot of these things aside to get working on that stuff.
Yeah, absolutely.
Okay, so I don't see any other new questions in the room. So I do want to remind people who are on the call or watching this later, if something comes to mind and you'd like to ask your question or share your concern, you can email us at covidconcerns@amherstma.gov. Emma now also receives those emails. So feel free to send us any follow-up, clarifying questions to that address, and we will get you some more information. At this point, I'd like to have Emma or Paul share anything that they didn't get asked or something that they want to leave folks with.
I know for myself, for public health, that there are some tips for a safe Thanksgiving that I know we're looking forward to publishing, I think on the town website and maybe the social medias that we're associated with. But those tips for a safe Thanksgiving are available on mass.gov. And they have a nice poster. It's basically, do wear a mask when not eating or drinking. Do keep your distance at 6 feet apart. Do wash your hands often. Hopefully your hands will be open when you're washing them. And then do improve your ventilation in your home and windows to keep you safer if you're gathering with family. And there are some don'ts in there too, but I really want to focus on the positive ones. But really it's don't share food or drink, limit social touching, and try to not gather with high-risk individuals. But I know celebrations are part of what keeps us emotionally and spiritually well and resilient. And I just want to give people those tools to be able to be safer during this time.
Yeah, I just want to add on to that, I think we're all struggling with our own families about how we're going to handle Thanksgiving or any other holidays. And just sort of understanding that this year is just going to be different, and it's unfortunate. It's really mentally hard to get there. But it's something we have to buckle down and sort of figure it out, because I think family spread, the disease in small family groupings is really concerning. That's why you saw the governor step up and put all these additional orders out in terms of limiting the number of people in a house at any one time. So it's going to be tough.
And you can find that information that Emma referenced on our Amherst COVID19.org website, and as well as if you follow us on social media, it's been shared there as well. Okay, well, we are about to wrap up. I want to thank everybody who joined us live. Again, feel free to reach back out if we didn't answer your question or you want more information. And we will be putting this up on our Amherst Community Chat playlist as well. So thank you, Emma. Welcome. And thank you, Paul.
Thank you.
Yes. Bye, everybody.
Goodbye.